Hi, I'm Amanda Olson from IntimateRose.com, and I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist. And these are the Intimate Rose anal or rectal dilators. They come in 8 sizes, and they feature smooth, soft silicone to help gently and progressively provide dilation and tissue training to the anus and the rectum. The smallest dilator is very small, much smaller than my finger, and they gently become larger to provide that gentle stretch. These are ideal for people that have had colorectal cancer, colon cancer, other forms of cancer that involves radiation or chemotherapy that have resulted in stenosis of the anus. Also for people that have upcoming medical procedures or surgeries that will require them to have better opening of the anal canal itself. For some people with functional constipation, the anal dilators are ideal. They can also be helpful for people that have goals around anal penetration. These smaller sizes here feature a gentle small bulb here that allows for a gentle stretch of the anal sphincter without overstretching it and allowing it to come back to a resting state. Training is generally performed 15 to 20 minutes a day. You just lay down on your back, use a generous amount of lubricant, and it's going to gently be worked into the anal sphincter and into the rectum itself. The dilators are very flexible to accommodate for that rectum so that you get the good dilation training without it being uncomfortable. For more information, or if you have any questions, please don't hesitate to visit our website, www.intimaterose.com.